Good afternoon, everyone, and thanks for joining us today. Apologies for the delay. In the radio room in Regina, we have Deputy Premier Gordon Wyant and Chief Medical Health Officer Dr. Saqib Shahab. Joining us over the line in Saskatoon is SHA CEO Scott Livingstone. This is a 2-minute warning. Good afternoon, everyone, and thank you for joining us today. Again, in the Legislative Building in Regina, we have Deputy Premier and Minister of Education, Gordon Wyant. We also have Dr. Saqib Shahab, Chief Medical Health Officer. Joining us over the line is SHA CEO Scott Livingstone. Both the Deputy Premier and Chief Medical Health Officer will have an opening statement, followed by questions.
Well, thanks very much, and good afternoon, everyone. Today, I'd like to provide you with an update on the status of Saskatchewan's Safe School Plan. The Government of Saskatchewan, the Education Response Planning Team, and Public Health continue to work on a plan for a safe return to schools. As you know, the education in Saskatchewan is very diverse. We have schools ranging from 4 students to over 1,600 students. We need to consider what works for all facilities, so today we're providing guidance to ensure school divisions have the public health information they need to make their decisions for their local school divisions. Our recent discussions with Saskatchewan's 27 school divisions have been focused on the usage of Level 2 under the Safe School Plan. As a result, the province and Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab, are providing some additional guidance today. With a number of divisions expressing interest in mandating mask usage, it is recommended that the requirement to wear a mask will be specific to high traffic areas, such as in hallways and on school buses. This should apply to all students in grades 4 through 12. For those students in grades 9 through 12, masks may also be required in classrooms where it's not possible to maintain a level of physical distancing. The guidance on mask usage would also apply to teachers and to staff. Regarding the use of Level 2, students and staff are encouraged to bring their own non-medical cloth masks. There are existing guidelines available on saskatchewan.ca that speak to this and that parents and others can access. As well, we have procured 6 million disposable masks for school, which represents an initial investment of $2.3 million. These masks will be available to students, teachers, and staff at the beginning of the school year and on a daily basis. The government will continue to work with individual school divisions with regard to their PPE requirements. As I mentioned earlier, our schools are diverse, and we will continue to consider that diversity. So for those high schools that have a high density population, further discussion with Saskatchewan's 27 school divisions have resulted in factors for those divisions seeking clarification on Level 3. Level 3 provides for hybrid learning models, which may include the use of alternate instructional days. Factors that would also be considered include location, structure, and population density of the school. The Ministry of Education, in consultation with Public Health, will work with school divisions to determine the application of those factors. Saskatchewan's Chief Medical Health Officer has also directed the following additional measures be included in all divisional plans. Teachers and class cohorting, with focus on cohorting teachers to a limited number of students and keeping students in one cohort as much as possible. In elementary school settings, student cohorts will be the classroom. In high school settings where cohorting is more complex, school divisions will be encouraged to find creative solutions to move students in cohorts wherever that is possible. Front-facing instruction for students, any exceptions will be identified by school divisions for approval by public health, and staggered start times, breaks, and end times wherever that's possible. Our government continues to monitor the transmission of COVID-19 in the province, and updates will be made to the Safe School Plan as necessary based on the advice of the Chief Medical Health Officer. The response planning team will also continue to work with the education sector to develop and implement new guidelines as the pandemic situation evolves. And with that, I'll ask Dr. Shahab to make some comments.
Thank you. So I'll just start with some numbers for today. So there are 29 new cases of COVID-19 reported today, August 11th, bringing the total to 1,479. As you can see, over the last 5 or 6 days, the numbers fluctuate from a low of 5 to 30. And so we are seeing a bit of a higher transmission than we had been seeing in the early part of the summer. Of the new cases, there are 17 in Saskatoon, 4 in Regina, 4 in the southwest, 4 in the south central, and 1 in the northwest. So again, they're broken up into more specific geographies for people who want to look at the map online to see where active cases are. And of the 17 in Saskatoon, 11 are in communal living settings. So about 2/3 of our cases overall over the last 6-7 days have been in communal living settings, but the rest have been in a variety of settings, workplaces, and just sporadic cases. And again, even though our maps show cases in more detail, I think we have to remember that COVID transmission is a low risk throughout Saskatchewan, and that's why we need to continue with all the precautions we have been taking while enjoying the rest of the summer. Of the 1,479 reported cases, 165 are considered active. So again, a decline in our active case numbers, which is important and always good to see, and that 1,294 people have recovered. 11 people are in hospital, 6 in inpatient, and 5 in ICU. And again, our hospital rates had been going up a bit, but they seem to be settling down now, so that's also good. And 113,972 COVID-19 tests have been performed in Saskatchewan, and testing capacity continues to be higher than the need, and that's very positive as we head into the fall. It's 3,000 tests by day and increasing to 4,000 tests by day for September. That'll be the testing capacity, and that obviously will meet any needs that may arise. In terms of some specific comments around schools, further to Mr. Wyant's opening remarks, it is extremely important for us that we look after the safety of students, teachers, families, and so there's been lots of discussions on these things, as was mentioned, between health and education, with school boards, and that has led to a further analysis of where we are in terms of our COVID transmission risk, and we probably would be better off starting at a high level 2 for mask use initially, and then we can recalibrate as things settle down. And similarly, for some of the larger schools, they can look at, initially where other adjustments are difficult, maybe level 3 options for a few schools, just to start things off in as safe a manner as possible. And once things settle down, obviously they can recalibrate in consultation with the local medical officer of health. It's really important, I've been saying for some time now, that all of us should have 2 or more reusable cloth masks for use, and that applies to students as well. We really need to have a mask on hand. If you're going to an indoor public place, we can put a mask on. Schools are a bit different. They're not like a public place. They are a place where you sit with the same cohort, especially K to 8, and high schools, you may be in specific blocks. But certainly in those settings, also in hallways where required, you can and should be able to put a mask on. But this doesn't replace all the other measures that have been so important, not going to school or work if you're sick, washing your hands before and after eating and after using the washroom, trying to maintain as much physical distance as you can, remaining in your own cohort or bubble, and even within school, the consistent set of friends, and you can be closer together with that consistent set of friends, but generally avoid mingling with large number of students in the school setting as well, and especially important message for high school students for this year as well. So with that, I think we're well positioned to start off the school year safely. It's been 5.5 months since we went to online schools and then summer vacation. But with this, I feel very confident that we'll start off in a smooth way, and then we'll continue to recalibrate if we need to make any adjustments. Thank you.
We now have time for questions. We'll take our first question from the phone line.
We have Chris Vandenbreckel with CJME.
Hi there. In regards to the plan, a lot of language here about.
Sorry, Chris. Operator, we're having some trouble hearing the phone line in the room. Chris, could you repeat your question?
Hi, can you guys hear me okay now? Is that better?
That's better. Thank you, Chris.
Okay, thank you. In this update, there's a lot of talk about suggestions, encouragement. Why not move to level 2 across the board to start out and then recalibrate, as Dr. Shahab says?
Well, we've been having these conversations for a while. Certainly, all the school divisions have presented their individual plans for their safe return to school. We've always respected the local decision-making of school divisions when it comes to making decisions at the local level. Certainly, school divisions have the best information at a local level with respect to the realities in their classrooms and in their schools. So while we know there's a number of school divisions that have expressed an interest in masking policies, not all have, although we will continue to have those conversations with those school divisions. And so we really thought that it was important, given the diversity of our schools, given the diversity of our school divisions, that school divisions have the opportunity to make those decisions. And so the recommendations that have been made today are that. They're recommendations that have been made by the Chief Medical Health Officer in terms of establishing guidelines for those school divisions that are looking at some kind of a masking policy within their schools.
Follow-up, Chris?
In the update that came out yesterday about the policies in terms of kids who become sick at school and the policies in terms of isolating them, getting the parents to come right away to pick them up, it still seemed vague when it came to what happens to the class when there's a positive COVID-19 test, either with a teacher or a kid in the class. You talked about how the health ministry or the health authority would evaluate through. A lot of parents are asking for a specific criteria, specific policies. What exactly would happen when a kid becomes sick with COVID-19 in a class? Would that class be self-isolated? Would families be self-isolated? Would teachers not be able to work? What do you do with substitute teachers? Is there any more detail that can be provided in that vein?
I'll let Dr. Shahab just comment on the second part of your question. The idea for establishing an isolation facility or an isolation room in the schools was precisely for that, to ensure that children who are exhibiting symptoms can be isolated from the school, and they can be in a place where they're supervised by staff until parents can come and remove them. I'll let Dr. Shahab speak to the second part of that question.
Yeah, thanks for the question. So I'm in regular contact with my medical health officer colleagues throughout the province, and they are in turn in regular contact with school divisions. But first of all, I'll say that having a child first of all, we expect that children who are unwell will stay at home. But if a child does become unwell in school, that is nothing new for the school system or public health. You have children who break up in a rash, who have all kinds of symptoms that present while in school, and they're then, taken from the class to wait till parents can pick them up. And depending on the symptoms, rash, fever, cough, diarrhea, public health is always consulted. Similar processes will apply in this situation. Now, we have to remember that in February, March, when there were coughs and colds going around, which we'll again see in the fall, starting with the colder weather, while we had a lot of testing, less than 1% was actually positive for COVID. So every cough or cold doesn't mean it's COVID. But having said that, when once children go home, testing will be arranged through 811, and public health will be informed if the test result is COVID positive. Children who are in school will be high priority, just to make sure test results come in a timely way. And then if a child is COVID positive and was in school, then, again, public health has been doing detailed case contact investigation for the last 7 months. So similar processes will apply in the classroom setting. And I don't think we can say automatically that just because a child was COVID positive, the whole class will be dismissed. It will depend on when the child becomes symptomatic, what were the child's activities in the 2 days before start of symptoms. And if a child was, not really in close contact with more than 4 or 5 children in the class setting, it may just mean that possibly 4 or 5 children who are closer to the child would be asked to stay home for a couple of weeks, but letters would go out to the rest of the parents to just self-monitor their children for symptoms. Or it may mean that if there's more mingling in the class, as reported by the teacher or children, and there may be rarely a reason to suspend the whole class for a couple of weeks. But it is something that will be addressed on a case-by-case basis. And again, we have looked closely at transmission in the workplace. We've looked at settings where individuals have gone to school and then later out found to be COVID positive. And in some cases, transmission does happen, and in many cases, transmission doesn't. So again, it's just something that we expect the risk to be the same as it has been in workplaces, and where there is usually a limited transmission, but not more than that. But certainly, all parents will be notified as appropriate to self-monitor and seek testing as appropriate.
We'll take our next question from the room. Staff?
Yeah, to the minister, I understand that school boards and schools are diverse, but it seems that the advice around wearing masks is not, from the Public Health Agency of Canada, from a number of different doctors, grades 4 to 12, mask up in crowded areas where you can't physically distance. So under your plan, why is it okay that some students may be more protected in some schools or some school divisions versus others because their leaders have so chosen to bring in this policy?
Well, I think it's important to remember that the decisions that will be made at the local school division level won't be made in isolation. They'll be made in concert with conversations with local public health and with the chief medical health officers and public health generally. So to the extent that there will be those conversations, certainly those decisions won't be made in isolation by the administration of a school division without the input from local public health. As I mentioned before, the schools are very diverse, and so to suggest that in one particular circumstance when you can socially distance in one school or one classroom may be completely different than another school, especially schools that have high populations. So we think that the guidance that's been given by the Chief Medical Health Officer today to those school divisions that are considering masking is appropriate in circumstances where social distancing, where physical distancing isn't possible. So there may well be circumstances in school divisions, and we know of a number of them, where physical distancing is going to be, there'll certainly be allowable because there'll be space, but in others there won't be. And so, as I say, they won't be made in isolation, they'll be made in concert with local public health.
Follow-up, Steph?
Yeah, but what your government is doing is really leaving all the decisions to be made at the school division level, and instead of maybe saying mandatory masks are going to be mandatory from grades 4 to 12 for all students and staff when they can't physically distance, you are not saying that. Instead, you're leaving it up to local school divisions to decide that for themselves. So I'm still not understanding what was wrong, or what's preventing you, or where the resistance is coming from a mandatory masking policy for all schools, all school divisions, which is being called for by many parents and teachers.
Well, I'll let Dr. Shahab speak to some of the medical advice that he's been receiving. But again, the decisions with respect to whether or not there will be masking in any particular school will be left to the local decision makers in consultation with public health. I think it's fair to say that all along, and it's one thing I agree with the opposition and Carla Beck about, is the importance of ensuring that local school divisions make the local decisions that they need to make around this in consultation with public health, much as they do with a number of other things, and Dr. Shahab has talked about that in terms of parental notification. There's lots of protocols in place with respect to how certain things happen in schools, whether that's lice or pink eye. So I think it's important for local school divisions to make these decisions in concert, not just with public health, but with their local schools. And I'll let Dr. Shahab perhaps elaborate.
Let's say, so in a few jurisdictions in Canada, school did continue for about 4 weeks in June without mask use, and lots of lessons were learned from that. We are conscious that we are starting the school year in a situation where our general COVID transmission rate is a bit higher than May, June, but not too high. Having said that, I think it's a reasonable thing to start with in level 2 for all schools, where mask use is an option that should be considered, and schools need to apply it as appropriate in their setting, whether it's on corridors and locker areas, washrooms, or even in a class where you can't maintain that 1 meter plus physical distance. Having said that, it is important also to provide mask-free time for students. For example, during recess when they're outdoors, they don't need to wear a mask. And I think part of it relates to what we do in society. In the fall, all of us will probably be expected to wear masks more frequently in a public place anyway. So I think the same school should be a mirror of, in some ways, of what we are going to do out and about as well. But we'll have to monitor. This is, we have not opened schools during a pandemic, as have many jurisdictions, and we'll have to monitor. We don't expect COVID transmission to increase generally, as long as we all keep doing what we're doing. We don't expect to see school opening have a big impact on COVID transmission, but having said that, if we see signals that there is a signal of concern, especially in the community in which schools are situated, and the recommendation of mask use and other steps as in terms of level 3 may be required at a local level.
I think just one further comment. I think the changes and the suggestions and the guidance that's being provided today is evidence of the fact that this is an evolving situation and things are changing. And we've always indicated from the beginning when the plan was first put together that things would change and things would evolve. And I think the recommendations that the Chief Medical Health Officer is making today is simply reflective of that evolution, that things are changing, and they could well change the other way before school starts. But we will wait and see.
I just want to go off one. Dr. Shahab, you just said that, because COVID transmission is higher right now than it was in the spring, level 2 is a good place to start. But under this plan, school divisions choose whether or not to do level 2. So do you see the issue here? Like, you're not saying all schools have to start with mandatory masks. You're leaving it up to school divisions, which to some may seem a bit contradictory to the evidence and the advice you're providing.
Well, as I mentioned before, every school is different. Every school division is different, and we really think that in terms of ensuring that there is adequate protection by students, that the local school divisions, in concert with their local health officers, will be the best ones to determine where masks are appropriate and where they're not. So, with the recommendations that have come down today for high traffic areas, for busing, for classrooms where social distancing isn't an option, or there's some issues with that, I think that that's an appropriate place to start, and that local school divisions have the option of deciding how they want to proceed. But what we're trying to do today is to provide guidance to those school divisions that want to move forward with a masking policy under level 2.
And one thing I would like to suggest, though, is that for all parents, that make sure your kids have a couple of masks. Make sure they keep a mask on at home, just to get used to it. Take it off and put it on safely. Are able to take care of their mask themselves, wash it when you come home and hang it to dry. And I think that's really important. Many children are starting school for the first time. Many are starting high school for the first time. We don't want children to be, too stressed out by all the new changes beyond, starting school again after 5.5 months. So again, mask use is a bit of a new thing, and I think all of us need to be comfortable putting on a mask where required, taking it off, keeping it safely with us while we're out and about. And for children, I think this is a good time to start practicing mask use for a few hours a day.
We'll take our next question from the phone line.
We have Laura Woodward with CTV.
Hi there. I'm just calling to ask about Saskatchewan's testing strategy for schools, and would Saskatchewan consider testing pools where a bunch of samples are put into one test?
Yeah, so that's a really interesting concept, and I'll just say a couple of things, and Scott may want to add to that. One aspect of testing is that there's no threshold testing available. Anyone who's symptomatic or otherwise can seek testing, and obviously if you have symptoms, that's important for you, it's important for your family and close contacts, but it also informs all of us in terms of numbers and the geography and where transmission is happening. So that's important. Within the school setting, should there be surveillance in schools as the way it's described? We already do surveillance in schools every year. In flu season, we do surveillance for all types of illnesses, and and COVID will be added to that surveillance. It won't necessarily involve testing per se, but obviously, whenever children test positive or staff in a particular school, that's added to our surveillance algorithm. But if required, especially if there were cases or clusters in schools, broader testing may be considered. So it would certainly be considered in those situations as well at this point.
Is there a comment on the line from Scott?
No, I have nothing to add, Jim.
Follow-up, Laura?
Yeah, have health officials determined the source of the initial infection at the K-Bro linen facility in Regina? And what's being done to ensure the safety of the employees when cleaning linen that may have been used by a COVID patient at a hospital?
Yeah, so I'm not aware of the source of infection in the index case, and we can try to get that information. But again, I think we need to recognize that COVID transmission is a low but real risk in all settings, whether we're out shopping or at workplaces, and potentially in schools. And we just need to manage it. And what I've heard from the excellent outbreak investigation that was done by Regina Public Health along with the facility was that around 200 staff, they were all practicing all the precautions, mask use, physical distancing. But sometimes transmission does happen, and what we've seen it happens when during a lunch break or other settings where you may be interacting otherwise. So we just need to recognize that, and the fact that it's gone up to maybe 11 cases and not further, and almost everyone in that facility has been tested. So there's been extensive testing and reassurance that the outbreak is contained. And I think this is just an example that clusters do happen in workplaces, and they are managed. And if we're all taking basic precautions, mask use where required, hand washing, physical distancing, not going to work if you're sick, even if a case or cluster does happen, it doesn't expand into a major outbreak. And secondly, we have consulted with our medical microbiology colleagues, infection control colleagues. Just like when you have a cluster in a food facility, there's no risk to the public in terms of the food. And similarly, the assessment is that there's obviously no risk to anyone using linens from that facility. Their processes ensure that there's no risk of COVID transmission from products that come from that facility.
We'll take our next question on the phone line.
We have Anna McMillan with Global.
Hey there, I just want to follow up on Laura's question. Can you just tell me a bit more about why you're not considering regular pool testing in schools? Is it just that the province doesn't have the capacity at the moment?
So, I just want to reiterate that, the pool testing, so just to explain it, is that it could be that an entire cohort of whether students or workers are tested at regular intervals. So I think conceptually it's an interesting concept. We have to understand that COVID is a marathon, not a sprint. We are in the pandemic at least till June next year, if not longer, depending on if there's an effective vaccine available and when. So from that perspective, even if you do pool testing one day, it tells you nothing about the next day. So there may be settings where you have ongoing clusters or cases where it may be applied in a very systematic way. But I think we have to be cautious of not be over-reliant on these initiatives. I think our basic measures that we've all been practicing since February have worked well for us, and I think that's what we need to put the emphasis on. Testing, the Saskatchewan Health Authority has gone to great lengths to increase testing rates, but it is a resource that we need to use judiciously and where appropriate, but we'll continue to monitor these and other options. And I want to see if, Scott, you had anything to add to this?
No, I'm good.
Do you have a follow-up, Anna?
Yeah, just wondering what the response would be if a student got tested individually and then obviously tested positive. Would the province then considering going into that student's classroom and testing their peers?
Yeah, so we already have a lot of experience now with case content investigation. So based on the setting, in the household setting, the direction may be from public health that you have to stay isolated for 14 days and seek testing if you become symptomatic. But if there's more of an outbreak situation, all close contacts may be offered testing. So that's certainly true if it's in a closed facility like a workplace or a personal care home and a long-term care facility. With schools, again, it would depend on what the child was doing, and if the child was pretty confident, especially that they didn't have more than 4 or 5 close contacts, and that is confirmed by interviews with the teacher and other colleagues in the school system. It may just mean that the child and 4 or 5 close contacts would be asked to self-isolate at home for 14 days. But in other situations where public health can't confirm that everyone in the class was not potentially a close contact, closer than 2 meters, there may be a consideration to dismiss the entire class back to online learning for a couple of weeks, so that if further cases present, they are already at home. But we'll have to see. I think we want to maintain in-class learning as much as possible, minimize disruption, but at the same time minimize large outbreaks. And we've already learned a lot from workplaces where everyone doesn't just go home if there's a case or a cluster. People are under ongoing monitoring, and similar principles would apply in the school setting.
We'll take our next question on the phone line.
We have Phil Tank with the Star Phoenix.
Yes, I have a question. When the school reopening plan was originally released in June, we were told that it was developed under the direction of Dr. Shahab. So I guess I'm just wondering how it evolved from there. Like specifically, it seems like you put the plan out there and then the school divisions have gone back and made suggestions and made submissions. I guess I'm wondering why it didn't work in reverse, why you didn't go to the school divisions first and ask them for their input and then build your plan from there. And then, have you, Dr. Shahab, expressed misgivings about the plan?
Yeah, so do you want me to?
Sure.
So I'll just say that, as I mentioned, a few provinces did open schools in May, June, and in a different way than those provinces are opening schools now. And in May, June, we also had gone down to extremely low rates of COVID transmission. We were, for the most part, in lockdown and gradually emerging from that. We had gone down to 0 to 5 cases a day. And based on the information at that time, that reopening school plan was perfectly appropriate. And school divisions looked at that to do their initial planning. But we also knew that, as the summer progresses, we'll be looking at evidence from other parts of the world, notably Europe, and in the Southeast Asia, where they have had a school year or our summer, which is their winter, and learn from that. And based on that, most provinces, including Saskatchewan, we've developed levels so that you can go from a lower level to a higher level and back to a lower level based on COVID transmission risk. And so we will have to be flexible and nimble as we move forward. And that's just a reflection of that we have to look at the best evidence and apply that appropriately. And certainly the Public Health Agency came up with their updated guideline. They had issued a school guidance that was very similar to our plan, I think in March, April. But now they have updated the guidance as recently as last week. So I think all this means is that we need to continue to look at new evidence and be flexible and not be rigid, but at the same time support processes that minimize disruption to, and we've seen that with our reopening of Saskatchewan, that it's gone for the most part very smoothly. We do see the occasional transmission in many of these settings, and that's managed, and we would expect the same to happen in schools, even though the school is a very large sector that's reopening, and we are certainly very conscious of that, and we are very sensitive to the fact that parents have concerns, their students, their staff, and it is important to listen to all concerns and accommodate all those concerns, but also give the best advice relevant to what we have as evidence now, especially from the experience of other countries who've had a few months now of having schools open.
Phil, when those guidelines were first developed, they were certainly developed in consultation with public health and with the chief medical health officer. And the preparation of the local plans certainly were, in our view, and they're all consistent with those guidelines, responsive to local conditions. As I mentioned a number of times, school divisions are different and schools are different within those school divisions. And so those plans are very responsive and compliant with the guidelines that were originally put out. Certainly all have been vetted by the response planning team, which you'll know has been made up of school board trustees, the STF, public health, and the Ministry of Education. So we feel quite comfortable with the plans. The idea today is to provide some additional guidance to those school divisions. So my message to parents today is that they can be very confident in the local plans that have been developed by those school divisions, because they've all been done not only in consultation with public health and with the chief medical health officer, but with educational professionals who have vetted those plans. And so I feel very confident in the plans. I know public health feels very confident in the plans, and as additional guidance may be directed through by the chief medical health officer, we'll continue to provide that guidance. But certainly the local plans are responsive to the local conditions, and I think that school divisions have done an excellent job in preparing those plans so that children return to school in the fall in the safest way possible.
You have a follow-up, Phil?
Yes, when you mentioned that in the news release today, it says that cohorting can be difficult in high school settings and that you encourage creative solutions. I'm just wondering, can you give me an example of a creative solution there?
Sure. Well, we know that one school division, and there is possibly others, but I know of one that's going to be implementing block scheduling, right, and different semesters. And so to ensure that there is a reduced number of students in a class at any one particular time, they may well go to alternating days. And so there's all different options that are available to school divisions. They certainly know what they are. They have experience with a number of these things. And so there are a number of creative solutions that have already been put forward by school divisions, and I know that school divisions through the SSBA and through their leadership in those school divisions are having conversations with each other about what some of that might look like. But those are two examples.
We'll take our next question from the room. Steph?
Yeah. Minister, what's your message to students themselves or parents of kids or even staff who happen to find themselves maybe working in a level 1 school where they themselves would want to see masks mandatory, but that's not something their school division has decided to bring in for whatever reason? What's your message to them?
Well, school divisions, we've provided this guidance today. If a school division wants to move past the guidance that's been provided today, that's certainly available to them. There's nothing preventing teachers from masking up in a classroom. We know that many school divisions have purchased masks and shields for their teachers to protect them in the classroom. And there's nothing preventing students from wearing masks in the classroom should parents direct their children to do that. So my message really is, I think that to the greatest extent possible, what we've done today is added some more certainty in terms of guidance for those school divisions and for those parents to ensure that their children are safe. So I think that that's been pretty clear.
Follow-up, Steph?
Yeah. You know, the Public Health Agency of Canada has really kind of laid it out quite bluntly, which is grades 4 to 12 wear a non-medical mask when you can't physically distance. That seems pretty straightforward, but that's not what your plan seems to be crafted on the advice. You're leaving a lot to what does the school look like? Maybe the school division doesn't want mandatory masks. We're going to urge, we're going to recommend. So why is it okay that your government's plan when it comes to masks in schools kind of is different than what the Public Health Agency of Canada is saying?
So, I mean, my understanding is that there's a wide variation in school sizes, and also there will be a lot of differences in local COVID activity. So my understanding is that most schools will actually start at level 2 where mask use will be required. Will it be required all the time or just in school buses and in corridors or locker areas or even in classrooms? I think that is up to each school to figure out based on how classes are set up. Some of the larger schools, where there's, and again, mask use is just one of a hierarchy of control. So I think they would need to look at all the other principles as well about reducing crowding in terms of staggered break times and those kind of things. But certainly, mask is an important but not the only tool that should be used. And I think we need to make it so that in terms of instead of creating a lot of churn and concern about this, use all these tools. Let children and teachers use all these tools when school starts, get comfortable with that, because again, wearing a mask several times a day or having to wear it for 4 or 5 hours is not something a lot of children will be used to, a lot of teachers. We just need to start using that, see how things continue, see how COVID activity is, and course correct, either go to a higher level with greater emphasis on mask use and other measures, or readjusting and just relax a bit if after 2 or 3 weeks everything seems to be fine. I think that's how we need to proceed. We are reopening during a pandemic, and we need to learn continuously from how it rolls out, and make it easy in the initial few days. Let children feel comfortable, not afraid to be in school. Let parents feel comfortable, and same goes with teachers and staff. I think it's really important for us to work together so that everyone feels comfortable, secure, and then we can see how things proceed.
We'll take our next question on the phone line.
We have Alex Soladucha with CBC.
Hi. So last week the plan said that level 2 would mean that mask usage is determined by the chief medical health officer. And today you're saying school divisions will decide. What's changed to lead to today's announcement? Can school divisions stay on level 1 if they want to? And Dr. Shahab, do they need to consult you, or can their decision be completely, unilateral?
Well, as I mentioned before, and I'll let Dr. Shahab comment on this as well, decisions with respect to mask usage within schools will be determined by the local school divisions in consultation with public health. So there's an ongoing conversation. Certainly the relationship between public health and the school divisions is a long-standing one. They consult on a number of different matters, and so it wouldn't be unusual for the school division to consult with public health on this matter. And so they're not going to be made unilaterally by the school divisions without having some input from public health.
Do you have a follow-up, Alex?
Yeah, Dr. Shahab, do you think reducing class sizes would be beneficial? If not, why not? And if so, why not push for that to happen in terms of budgeting? We saw the healthcare system scale up, so why aren't we doing that in education?
So my understanding with discussions with the business response team of education is that there's a wide variation in class sizes and also how big schools are. And all those factors need to be taken into account, and that's why, while in most cases physical distancing at least 1 meter can be attained within classrooms, there may be situations, especially in some of the larger schools or within some of the larger schools where classes are bigger, where that option may not be feasible initially. So the other options may be considered, including using larger spaces for bigger classes, or to start off with using some principles as in level 3, or in cohorting in ways that you can at least initially have greater physical distancing, and as things settle down, reassess about how schools should proceed. So for example, a few schools which may start at level 3, which is alternate day attendance for certain high school students, only in certain large schools. Again, that doesn't mean that will continue once the routines are worked out and stabilized. Then they could go back to level 2 as long as COVID activity in the surrounding community was low. And similarly, we have seen that sometimes you can have outbreaks at a community level come up pretty quickly, and that's when schools should be ready to go to level 3 very quickly as well.
We'll take our next question on the phone line.
We have Mark Smith with CTV.
Hi. With some schools moving into level 2, how long does the government expect the 6 million masks to last? And are you being proactive in finding and acquiring more masks for when they do run out?
We are. We wanted to make sure that we had an initial supply of masks on hand for distribution to school divisions so that they had them. We know that school divisions have been sourcing their own PPE and masks and shields and the like, and so we know they've been doing that, but we wanted to make sure that we had a supply on hand, so we'll have the 6 million on hand, and we're going to continue to work to source further masks because we know that we're going to need some more. But I've instructed my officials at the Ministry of Education to continue to source those. So, but as I say, we wanted to make sure that we had an initial supply on hand to make sure that we can meet the requirements of the school divisions.
Follow-up, Mark?
Yes. With school divisions moving into higher levels, why not start every school division at higher levels and then move backwards if case numbers don't go up?
Well, I'll just make this comment, Mark, and I think Dr. Shahab wants to make a comment. Certainly, we've had about 10 school divisions now that have indicated to us that they want to go to a form of masking policy, and that's one of the reasons why the guidelines are being issued today. We've already got one school division that's already announced that this morning, and so we very much expect that there'll be other school divisions that follow suit. But there are situations, as I've said, that there will be schools where physical distancing isn't going to be an issue in the classroom. I know that there's a number of rural schools that have low populations that are going to be able to accommodate physical distancing within their schools, which won't necessarily require the use of masks in all circumstances. And so leaving the flexibility with school divisions, I've made this comment on a number of occasions, school divisions are certainly in the best position to assess in consultation with their conversations with public health to determine what their needs will be. And so looking at that relationship, looking at the very good advice that we've got from Dr. Shahab as the Chief Medical Health Officer and his officials, I think we're in a pretty good place with the plan that's going forward. And as I've said, I'm very, very confident with the school plans that have been put forward, and that's my message to parents.
And we have our last question on the phone line.
We have Omara Isa with CBC.
Hi there. This is Omara Isa. So I did have a question about the communal living situation with the 11 cases. Are you able to confirm to us if these are high-right communities?
So, I'm not going to comment especially on ethnocultural groups. I think we have to recognize that, we have already seen that whether it's a workplace, a communal living setting, cases and clusters that do happen. I think Saskatchewan Health Authority and Scott can speak to it. They've been working closely with all communities, urban, rural, remote, and I think we need to allow public health to continue to work with all communities to support individuals and communities when there's a case or a cluster, and we've had great success, and that's what we want to see. But I'm very conscious of the fact that I certainly don't want to keep pointing to specific cultural or religious groups in an ongoing fashion. I think we need to respect that COVID can happen anywhere to anyone, and we just need to deal with it in a systematic way and work. Communities need to work closely with public health. And I'll just see if Scott, you wanted to make any further comments.
No, just to agree with your comments, Dr. Shahab, and agree that, we continue to work with all communities across the province around protecting them and other residents around COVID-19 transmission. But I would agree with all the comments you said around, continuing to work down with leadership across communities to actually work on improving our relationships, but also inhibiting the spread of the disease across the province, not just within individual communities, because the disease doesn't know a boundary.
Follow up, Omira?
No, merci.
And that concludes our time for today. Thank you for joining us.